Hello. Okay, guys, welcome to our new session. So, actually, it's not a session, it is a topic that we should discuss. And most of the NEET aspirants they want to discuss about the topic and they have this fear. What is that fear? We will just learn today. Okay. So, actually, what is the fear that most of these doctors have? Most of the NEET PG or even INICT students have. See, one of the doctor previously 3 days back, actually, she dropped a funny question to me. I don't say it funny because I don't want to degrade anyone. But what is that question is, sir, you explained some topics regarding medicine as well as psychiatry, and I think you started surgery. Sir, I just want to ask a question. It might look like something like a ETBT like question, but still it's very much important for our like aspirants, right? Okay, go on, tell me what is the question. She asked me like, sir, for example, tomorrow is INICT. I don't have any time left. Or for example, the next month, first week it is INICT. I don't have any more time left. Now, can you tell me, sir? Can you suggest me? I'm not asking otherwise. What are the topics that I can leave? Leave means okay, if you just go on a superficial study, it's okay. Like, or if you just give a one reading, that will be sufficient. No need to just crunch it. No need to cringe on those topics. So, are there any topics like that, sir? That if only one study is enough, no need to depend on it. So, can you please suggest us some topics, sir, so that we can save down some time? That is their main factor. We can save some time and we can invest that time in some other aspect. I was like, okay, so you want that type of thing. Okay. See, doctor, okay, we'll directly come into the scenario. So the today's topic is about that one. That is, what are the topics in medicine that you can avoid, or at least no need of going for cringing those topics, which saves the time, right? So let's get into those topics, right? So doctors, first of all, medicine is a vast subject. So if you ask me the topics to avoid it, the first point that I want to tell is the topics which are related to rare diseases. Please, rare diseases, rare syndromes, rare syndromes. See, I will give you one example. Uh, Someone might ask you a question on Men 1 or Men 2 or 2A or 2B. 2B is called Men 3 and we have Men 4 also. So someone might ask you questions on men, that is multiple endocrine neoplasia, but no one will ask you questions about some rare syndromes. See, there are some rare syndromes. Even I don't remember those syndromes, right? For example, see, there are some syndromes. Actually, if you check in Harrison's, you have some rare syndromes. Please don't go around those syndromes. That is my sincere suggestion. I've seen so many NEET aspirants, they unnecessarily they try to mug up all these syndromes in their mind, but don't do that mistake. That is the first and foremost important thing that I want to speak. And one more important thing is, this is also a big mistake that most of you doctors do it. We have right here. So what is that thing? They say there is some conditions called autosomal dominant, autosomal recessive, allosomal or X dominant, X recessive. See, no need to remember all the conditions, making a big table and try to remember all those things. No, no. Forget about it that this time, this INICT, you don't get these type of questions. Just forget about it. You only focus on the clinical scenario, not autosomal dominant or autosomal recessive, X dominant, X recessive. This is all unnecessary waste of time. Don't try to focus on these things. But if you ask me some serious suggestion like, sir, then what we should do? I can tell you, like, you just take a gist of just 30 very, very important, and these 30 conditions are to be like that, which are repeated in most of the subjects. Those conditions should be like that, right? But if you just simply take a big list of 200 conditions, autosomal recessive, autosomal recessive, all these things is bullshit. It's waste of time. It's all bullshit. It's completely waste of. Don't just try to mug all those things. Okay, so just you try to take some important things, some important factors, something like 30 or 40 disorders, and those disorders you just make a mnemonic and remember autosomal dominant, autosomal. What are some of the other things that you should avoid in INACT? What are some of the topics of medicine that you should get avoid in INACT? If you want to study about supraventricular tachycardia, fine, you go and study. But in tachycardia, what are the things that you should focus on? Always treatment. Focus on treatment. Focus on treatment, not rest of the things. You study about ECG, that's okay. You study about clinical features, that is also okay. You study about criteria, that is okay. But always focus on treatment. Always focus on treatment. Always focus on treatment. Okay. Now someone might ask you, sir, regarding neural system, tell me something, sir. Nervous system. What we should study, what we should know. See, tracts, they should be studied. Tracts. And UMN and LMN. Upper motor neuron and lower motor neuron disorders that you should study. Cranial nerves, very important. Obviously, you should study. Then pyramidal tracts, yes, you should study. Areas, very, very important. This is one important thing that you should, I want to tell you for a million times. You just remember most important areas. See, no one will ask you about area number 12 or 13 like that. Area number 21, 22, 44, 45. So the main areas, Broca speech area, Wernicke's area, superior sulci, superior gyri, you just remember and you just revise the most important areas. And one more important thing I just want to tell here is why most of the doctors, they are not reading the basic anatomy of brain. Please doctors, please, you just read and revise the basic anatomy of brain. Why I am saying this? Because it will help in medicine, it will help in anatomy, it will help in radiology. In all the three aspects, the basic anatomy of brain, it will help, because you will get at least one CT brain. That is sure. One CT brain you will get. One CT brain, that is damn sure. One CT brain. Now one more thing is, in medicine, what other things that we can avoid? You will never get definitions in medicine. So always avoid all the definitions in medicine. But the very important thing that you should remember in medicine is criteria and protocol. Whatever criteria it is, whatever protocol it is, just remember. No more explanations. Criteria, protocol, very, very important. And INICET is fan favorite of criteria and fan favorite of protocol. So always try to remember the protocol. Every protocol, whatever the protocol it is. INICET will not ask about rare syndromes. One thing. INICET will not ask you about rare disorders. That is one more thing. INICET will never ask you about definitions. That is one more important thing. INICET will not ask you anything which is directly pointed. No, Inicet will not ask that those type of questions. What Inicet asks? Inicet asks criteria. Inicet asks protocol methodology, that is treatment management. Inicet asks the clinical features. So these are the things that you should revise, right? You should revise. For example, I will tell you, you take like, wait, I'll just fill it up. For example, I will tell you, if there is follicular carcinoma, what is the investigation of choice? It is, what you will do? Biopsy. But why you will not go for FNAC? That will be given in Inicet. That you should do. Why? Because follicular carcinoma, FNAC cannot differentiate between follicular carcinoma and follicular adenoma, because it cannot differentiate the invasion. Invasion can only be done in the biopsy. So the investigation of choice for follicular carcinoma is biopsy, not FNAC. Okay. Now one more thing. In follicular carcinoma, you do total thyroidectomy surgery, but you will not do lymph node resection. Why? Because follicular carcinoma, no lymph nodes are involved. If there is no involvement of lymph nodes, what is the point of doing the lymph node resection? So there will be no chance. Now, what is the most common spread of follicular carcinoma? Obviously, it is hematogenous. Why not lymphoid spread? Common sense. If lymph node is not involved, why the hell lymphatic spread will be there? So obviously it will be only hematogenous. So that is you get that spike, you get that reason, not definition. You get reason, not definition. Everybody knows you have orphan annii nucleus. Everybody knows summoma bodies. Most of you will expect summoma body pathology from follicular carcinoma, but Inicet is different. It will give summoma bodies from the meningioma. You will get a case with the clinical features of meningioma with a summoma body. Obviously, the so-called student will confuse. Most of the times, he remember only follicular carcinoma, or roughly he might remember serous cystadenoma of power, but no one will remember the summoma body in meningioma. That one will be given as a clinical MCQ in Inicet. So like that. Now coming to subject wise, sir, which subjects can be left regarding Inicet? See, if you ask me like that, there is no subject that you can neglect regarding Inicet. But if you say like, sir, I just want to attempt, but I want to get most out of it, even though if I did not get the seat, no problem, but I just want to make sure like I am okay, like prepared for Inicet, then what subject I can avoid? Then if you ask me, you can simply avoid, say something like, you can just go on and avoid which subject? Go for derma. You avoid derma. Leave derma. Yes, that is my sincere suggestion. And if you ask me one more thing to avoid, leave anesthesia, but you study emergency medicine. Very, very important. Emergency medicine. Yes, so many doctors think like, sir, but emergency medicine come in anesthesia. No, yes, emergency medicine is a part of anesthesia, but you should make the difference between anesthesia and emergency medicine. You can leave the components related to anesthesia subject, but go with the emergency medicine. Emergency medicine means what you should read? Protocols. Which protocols? ALS, BLS, ATLS, protocols. Right? Anesthesia concepts means these cylinders, caps, and all those pins, indexes, masks, all these concepts come under anesthesia. But protocols and all this thing comes under emergency medicine. So if you want to leave subjects, you go over a dermatology, you just leave it. Anesthesia, you leave it. Then if you ask me one more question, then see, it might look something fishy, but you can leave ENT. Yes, leave ENT, and you can also leave out of. Yes, it is the maximum. These four subjects. Don't go beyond it. If you leave a subject more than these four subjects, then it is waste of attempting the Inicet. It's waste, pure waste. Why I said leave these four subjects? See, not because see, even if you are full-fledged prepared, there is no guarantee that you will get the seat. And besides that, if you leave four subjects, just leave about the seat. Don't even think about it. But what I want to say is, if you are a person, wait, I'll write here. If you are a person who is appearing for NEET PG, the major subjects should be your strength. The major subjects, that is something like you take pharma, patho, physio, micro, next SPM, gynec, surgery. These are all topics you should be very, very precise. Now, in those all those majors, you have these minors: derma, anesthesia, ENT, ophtha. You can just wiggle up these things, wiggle these four subjects. You just leave it off. If you can perform nicely with these majors in the INICT, then I can assure you, you can perform in the NEET PG also, no problem. So what my point is, the point of leaving the subjects here in INICT exam is to make yourself crystal clear regarding the other subjects, other major subjects transparent for NEET PG, so that you can get an idea like how much you are well prepared regarding the major subjects, which will cost you most of the time, because each subject will take not less than 4 or 5 days. So obviously, if you are very much perfect about the majors, then these 4 minors are not a big deal. You can just finish it off in 11 days. That's for sure, right? So if you are almost like 85% perfect in the majors, rest of the 15% is not a big deal. You can just make it off in the NEET PG. So these all things I'm just saying all these things in keeping NEET PG in my mind, right? Don't think like you forget 4 subjects, go to the exam hall and expect a seat in AIMS Delhi. No, you will not even get the seat of a driver also. Okay, even though you are 100% prepared for the INSCD, there is no guarantee that you will get. See, I'm not discouraging you, but I'm telling the facts. I'm spitting the facts, right? So don't even think about leaving a subject if you are preparing for INSCD. Don't even think about it. Leaving an MCQ is also a big deal. And if you ask me margin for just sir, how many MCQs we can attempt in INSCD? It's something like you just attempt. Now this figure might look like a big surprise. You attempt 98% of MCQ. Yes, 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 yes. What you heard is right. You attempt 98% of the MCQ. And trust me, 96% should be correct. 96 to 96.8% should be correct. 96 to 96.8%. Trust me. For example, you have 200 bits. You just attempt 185 bits. You leave 15 bits, no problem. You leave 15 MCQs, no problem. But you attempt 185 MCQs. And in those 185, 176 should be your target. You just leave 10 MCQs as negatives, 176 should be your target. And that will decide the rank. Don't blindly come leaving all the questions, right? So you should prepare like this. You should prepare in such a way that 200 MCQs, your target should be 190 correct. If you keep the target like 190 correct, then you will achieve a target of 175 or 177. Then this will fetch you. This might fetch you. I'm not saying that this will fetch you. This might fetch you. Maybe. If you want a seat for sure, then you should make it even more big, right? That is all about the video today. Do you have any doubts? You have any questions, queries regarding the Inicet? Please feel free to drop it down in the comment section. I'm very much happy to discuss with you. And if you have any sort of issues regarding the any sort of subject, any topics, you just please feel free to keep it down in the comment section. Right? So we'll come with the surgery for the next session. Till then, take rest, revise better, wise doctor. Thank you. Thank you.